And good morning again, or good evening, depending upon when you're watching and listening to this. This is For Your Health, a presentation of Medica Pharmacy. And with us again today, Alyson Schwartz. Good morning.
Good morning.
As we record this. First of all, I saw the press release while I was away. Your father recognized by, I believe, the Kentucky Kentucky Pharmacy Association.
Yes.
Tell us a little bit about that. I have the press release over there, and I should have had it in my hand.
He achieved the Bowl of Hygeia Award, and the Bowl of Hygeia is one of the most prestigious awards given out in all of pharmacy. Came about years ago, and it really resolves around service to others. And so, I joke that, you can't get it if you're young because you haven't lived long enough to do the things you have to do to be a Bowl of Hygeia Award. But it has to do with giving back and really being of service to not only to the profession of pharmacy, but to the community of which you live in. And so he's very honored to get that award, and we are all very excited about it.
We know he's deserving of it.
Yes, very much so.
In the work that Medica Pharmacy and he do in our community, but also in some other things. I think I saw him lobbying on behalf, and I'm sure it was on behalf of people in Washington a few months ago when I was up there doing the same thing on behalf of some radio.
He was, and then we went back up there in May. So, we go to Washington at least once every year to lobby, and then we go to Frankfurt multiple times a year, depending on what we need to do.
Well, our topic today is
sunscreen.
Ah.
Sunscreen. I decided, we've talked about vitamin D and being in the sun, but I thought, it's that time of year that, there's so many rising cases of skin cancer and everybody's like, well, maybe we need more sunscreen. We need better sunscreens. So I thought, well, let's talk about sunscreen.
Because you can get SPFs all the way up to, 30 and 60? And
over 100.
Over 100?
Which is a waste. Don't buy those.
Yeah. Well, that's what I was wondering, because my wife has this theory that for babies it maybe needs to be higher or... Well,
not necessarily. Okay. Basically, actually, high SPF is not a measure of the effectiveness of a sunscreen. And the problem with it is that it does not, like say you have an SPF of 80, it has no reflection on that sunscreen's ability to block out the UVA rays. It's more, in this country, it's more UVB. And I think I've mentioned on the show once before that, sometimes the FDA just doesn't do a very good job. Okay, so skin cancer is on the rise. It's tripled in the last decade. Melanoma cases have increased 1.9% every year since 2000. But we're
with
using
sunscreen
out there. So I found there's a company that really is out there looking for stuff that's not only good for you but good for the environment. And they reviewed over 750 sunscreens that we sell here in the United States, and only 1/4 of them were good for your skin protection and free of dangerous chemicals. So 1/4 of that 750. So on their website, and I'll give that to you guys at the end so you can check it out, some wonderful information about sun protection and skin damage. So only 1/4 of those. I think there's 184, 185 sunscreens on their website. And, everybody knows Coppertone. Well, there was only 4 Coppertone products in that list. So most of the sunscreens I had never heard of. Now, we are going to see if we can get some of those at Medica Pharmacy so we can offer some of these safer, better for you sunscreen. So I've got one of my girls checking on that today and tomorrow. So we'll see what we can find out. Interesting to know that the FDA's criteria for sunscreens is the weakest in the entire world. They said over half of the sunscreens that we sell here in the United States would not even be allowed on the shelves in Europe because they are not only are they not protecting you from the sun, the chemicals in them are unsafe.
What are some of those chemicals?
I actually have a whole list of those that we're going to get to.
Okay.
So we'll get one of them is oxybenzone. Like everybody loves the spray sunscreens because they're easy to apply.
Yep. Almost
every one of those has oxybenzone. And what's interesting to know about oxybenzone is that it's one of the highest rates of skin allergens for sunscreens. And I actually have experienced that. I'm not allergic to anything except for one medication that you don't hardly ever use. My skin will break out in a rash if I use a spray sunscreen, and we think it's because of the oxybenzone. The other scary thing about oxybenzone is it penetrates the skin so much that it is highly excreted in breast milk. So if you're a breastfeeding mom using a sunscreen, do you really want your infant to be taking in oxybenzone, which is...
Doesn't even sound...
No, it doesn't. And it's not really proven to be safe. So There are 3 very safe chemicals, Tenazorb S, Tenazorb M, and it's Meroxyl, I think it is, that have like no side effects. They don't really penetrate into the layers of skin to get into your bloodstream. They're what's pretty much used exclusively in the European sunscreens. Our companies that make sunscreens for here, we have the companies here also sell sunscreens in Europe, but they can't sell the same ones. Well, they've been petitioning to the FDA to allow these 3 chemicals to be used since 2006. So for over 7 years, they've been trying to get these used because they have the other thing about oxybenzone is it disrupts your hormones. Well, we already know we're bombarded with hormones in the world. We have lots of these women that have hormone imbalances, and so now we're going to add sunscreen that's going to make it worse. So the ones that are safer, don't disrupt the hormones, don't get into your bloodstream, we're not allowing in here, and they're shown to be so much safer. So I don't really get it, but I don't understand anything the FDA does.
Yeah, because you would think in this country that we would be the leader in innovation and doing things, and sometimes, as you just pointed out, we follow Europe and sometimes even Asian countries in some of the things.
We really do, and it goes back to when they started looking into Obamacare, I heard so many times we don't want European health care. And I got to thinking about that, and I would try to tell people, I'm like, do you know Europe spends a lot less money than we do, and their health status typically is a lot better than us. So I'm not sure why we are so afraid of European health care. I know people think about, well, if you get hurt, sometimes it takes a while to get into the doctor, but maybe they don't treat an acute illness as good as we do, but they sure do protect their health better than we do. And in the long-term course of things, that saves a lot of money and ends up being a lot healthier person. So, back to sunscreens.
Okay.
So, part of the problem they think is that they said you should really never, ever, ever use a sunscreen more than 50 proof. And really 30 proof is what we were always taught in school. But people use these high SPFs and they think, oh, I've got this 100 proof SPF, I'm good. So they tend to stay out in the sun longer. The difference between UVA and UVB rays is UVB is the one that gives you that skin burn, the one that hurts and is painful. That's a UVB. The UVAs, you maybe don't notice because it penetrates deeper into the layers of skin and causes lots more damage that you don't know it's doing. So you might be protecting from the UVB sunburn, but you're not protecting from the UVA. So I think in Europe, if it's an SPF of 30, it has to have at least SPF 10 of a UVA. We have no guidelines on how much UVA blockage we have. So the FDA has allowed our sunscreen makers to label them as broad spectrum, even though they really don't block the UVA. So that's what we're starting to see. We think people are just taking those false hopes to use that. And UVA is what they think is more linked to the melanomas. The UVBs cause the squamous cell and basal cells, which in the long term are not as dangerous. But the one thing you have to remember about melanoma is it is strongly correlated to sunburn. So people always think, well, I'm not going to get skin cancer because I'm not getting burnt. And that's, they're starting to see there's a lot more to that. It was interesting to know that when they were doing all these studies, that people that work outside for a living or that live in a sunny area where they're outside a lot more have much lower rates of skin cancer. And they really think that's because of the vitamin D you get from the sun. Vitamin D is an anti-cancer vitamin. The problem with it is, okay, well, let's just go take vitamin D. Well, if you're out in the sun, your body regulates how much vitamin D you get. It makes what it needs and not anymore. So if you're out there taking too much vitamin D, that could be dangerous too. So you can't regulate it. Your body can't regulate what you put in orally. It can regulate what you get naturally. The vitamin D, regular sun exposure without the sunburn is actually protective against skin cancer because of that vitamin D protection. So that's something definitely people want to think about as they're getting out there in the sun. So, tanning beds. You really don't want to go to a tanning bed. If you go on a rare occasion or if you're going to, just a few times before a trip to make sure you don't get sunburn, that's minimal. But what they did find is that if you start using tanning beds on a regular basis before the age of 30, you increase your melanoma risk by 75%. That's huge. Yes. I mean, why don't we just say 100%? Because 75% is not that much less. So you really need to avoid those tanning beds because they're just not even good for you too. Melanoma rates again higher in people that live in northern America where they don't get as much sun. So
and my thought on people, and I may have done it in the past myself, have gone to a tanning bed. No, I haven't because I've never been in it. They say, okay, I'm going to a place that's sunny. I'm going to be, on the beach or whatever. So I'm going to go get a little bit of sun to get started. They maybe could only say they did that for vanity's sake, because so that you would arrive with a little tan, because it really doesn't help you in the tanning process. Or
it does, and I think it does tend to, like, especially if you go from some here or somewhere north, maybe say January, February, and you're going to go down to Mexico or Key West or to the Bahamas, somewhere where it's probably going to be really sunny. It probably will help you prevent from getting that sunburn, because you do have a little bit of a base tan, but not as much as you would think. I mean, really, it doesn't. I mean, I actually had a friend of mine that went down, and she had a pretty decent base tan from the tanning bed, and she still burned, because it's different rays of UV. So you still have to protect yourself. You can't assume that that's going to be good enough. And so, yeah, sure, you don't want to go out on the beach, and you're stark white. But, you've got to think about it as long-term effects. And we're just not very good about thinking long-term. We're good about thinking about right now. Yeah. So that's the problem. You had asked me about the chemicals, and I mentioned some of those. So now I want to talk about something that a lot of women use is anti-aging products. And you see them advertised all over, so many anti-aging creams, and they have SPFs and they have sunscreens in them, but they have vitamin A in them. Now, it may say vitamin A, it may say retinol, and it may say retinol palmitate. Okay, so those are anti-aging for wrinkles. Interesting to know is they actually increase your risk of skin cancer. So you really should avoid moisturizers if you're going to be out in the sun, or sunscreens that have a vitamin A or a vitamin A derivative in them. And they're everywhere. I mean, they really are everywhere. So it's so important to look at the back of those, and even some of them, once you take them out of the container and they're in the little tube, there is no ingredients on it. So look at that package before you buy it, and you're looking for vitamin A, retinol palmitate, or retinol. Do not use those products if you're going to be in the sun, because you're increasing your chance of getting them. And most women, we use it on our face. Well, we don't want skin cancer on our face, because then you're going to have to get it cut off. We don't want skin cancer anywhere. But, I mean, you really don't want it right in the middle of your face somewhere. So avoid those vitamin A derivative moisturizers. And then a lot of the moisturizers and lip chapsticks, lip screens, do not have the right amount of stuff in them to truly be protective. So you can't even assume that that's right. So just go on and get that good quality sunscreen and put it on your lips, because a lot of people don't think about the lips. So, if you ever had your lips sunburned, and I have, it's not pleasant. And there are a lot of people that get those cancerous cells on their lips because they don't protect them like they should. Lipstick does not protect you. So go on and get the lotion you're going to put on your body and put it on your lips as well. So, and the other ones are oxybenzone. There's a 4-MBC, a 3-BC, and a octinoxate. I think I'm saying that right. And a couple of those are pending FDA approval, but they're also found in breast milk, and they do penetrate the skin. So, but all of these that I've just listed that are FDA approved, all of them act like estrogen or stimulate estrogen. And I've talked before about, estrogen causes breast cancers and prostate cancers and uterine cancers and endometrial cancers, and it makes you fat because it stimulates your fat cells. And so you don't want to be putting chemicals on your skin that penetrate into your bloodstream and then affect your estrogen levels, because you're disrupting the entire balance of the body. So be very, very careful. But oxybenzone is the most common one we see. And if you've got spray sunscreen, get rid of it. Throw it away. So two of the safest ones that we have in this country are zinc oxide and titanium oxide. And when you think of zinc oxide, you think of
white stuff?
The white noses of the lifeguards back in the 80s, right? But they have, taken it down and made it to where it's not, in products where you don't have the big white nose. But the great thing about it is they give you very strong sun protection. They don't break down very easily. And they're fairly safe, and they offer good UVA and UV protection. The problem with some of them is that they have started to break them down and make them into microparticles or nanoparticles, to where they're very small, to where they can then be put in a spray-on sunscreen. The problem with that is they are pretty risky if you inhale them. So they're fine if you put them on your skin in the form of a lotion, but if you're spraying them and that mist is inhaled, it's dangerous. So you want to be very careful with that. So use the titanium dioxide or the zinc oxide, but use it in the form of a lotion. Do not use it in the form of a spray.
I think the big white nose should come back.
I think it should come back too. I mean, it was cool back in the day. Get the great big sunglasses, and I think we should all get the tube socks with the stripes that we wear up to our knees. I do remember having those when I was little.
May still be able to find the pair.
I'm telling my age now, Rob. I shouldn't be doing that. So, a few just kind of rules as you're traveling this summer. Do not take any spray sunscreens with you. Do not buy the super high SPFs. Avoid anything that has oxybenzone in it. Don't use any loose powder sunscreens. A lot of mineral makeups, and there's like this powder that you can put on your skin. Again, you're going to inhale it. Don't use the loose powder sunscreen. Stay away from the retinols and the vitamin A's, and do not ever use the combined bug repellent sunscreen, because as you continue to reapply that sunscreen, you're getting way too much of the bug repellent, and it's very toxic to your system. So those are the big, don't do that. So what do you want to do? You want to cover up. Wear your sunglasses to protect your eyes. Wear a hat. Stay underneath an umbrella for some of the time, so that if you feel that you've been up there too long, cover up. Don't use that sunscreen so that you can stay out longer, because you're still getting the damage from the sun. So, stay in the sun as long as you should stay in the sun without burning or doing skin damage, but don't rely on that sunscreen so that you can stay out there all day long. Don't sunbathe. I mean, go out, swim, enjoy the time with your friends, but don't go out there with the purpose of just getting a tan. Don't use the tanning bed. Pick a sunscreen that has good UVA protection, okay? That's a little bit tough to do, but I'm going to give you this website here in just a second. Get your vitamin D. So get out there, get in the sun. If you really can't get in the sun, talk to your doctor, get your vitamin D level checked, find out what dose of vitamin D is right for you. There is a prescription vitamin D, it's D2. It's not that expensive, but your body has to convert it to D3, and you may not convert it all the way. So, studies have shown that there is no more benefit to the big high dose of vitamin D2 that you get prescription as to just buying anywhere from 2,000 to 4,000 units over the counter. 2,000 units for most people is plenty. You usually don't want to exceed that unless there's something really major going on. Last thing is, look at your skin. If you're a moly person, I have a lot of moles. I'm dark skinned. And I have a lot of moles, and pay attention to them. If any of them have irregular borders, if they look like they're getting bigger, go to your doctor, ask them about referring you to a dermatologist, get it checked out, because as with any cancer, early detection is the key to doing that. So if you want to get information on these sunscreens and kind of what to do, great website. It's the Environmental Working Group's website. So it's EWG, Edward, Watermelon, George, EWG.org. And then if you, it's a huge website of lots of stuff. So the easiest way to get to the sunscreen is after the EWG.org, put a / and then put 2013 sunscreen. And it'll take you to all kinds of information. You can sign up for a free sunscreen guide. But if you go in under there is a tab for the best sunscreens. And it'll list all the manufacturers of the sunscreens that they tested that were safest and the most protective. And then it'll tell you which one. So like on Copper Tone, it was one of the baby free and clears. None of them were spray, so there's only 4 copper tones on there. There was no banana boats that I saw. There was no Hawaiian tropics that I saw. So, you're looking at these going, I've never heard of these sunscreens. But like I said, we are going to try to find some to see if we can carry some at the pharmacy. So just check back with us, first of the week, and we'll see if we've been able to get some of those in.
But you pointed out, it's just being disciplined. If you're going to be in the sun, whether it be vacation or work or whatever, just be disciplined. Stay out of the sun. Wear a long sleeve shirt if you're going to be working outside. So many people think, I'm working outside, I'm going to wear short sleeves or no shirt at all. But those type of people are really at risk, because they'll do hours in the sun.
Right.
As an occupation, they have no choice. And of course, we found that wearing long sleeves doesn't necessarily make you hotter. It can actually keep you cooler. Just go over to the Middle East and see.
That's right. They all wear long black, and we all think of black as burning you up. And honestly, a lot of clothes, those UVA penetrates right through your clothes.
Right through.
So you still are going to get them, but you do need some sun exposure. So don't slather on the sunscreen the minute you go to walk out the door. I mean, go out there and get some sun without just a little bit with no sunscreen, but make sure the sunscreen you use are not the toxic stuff. I mean, everybody I know has spray sunscreen. And almost all of them have the oxybenzone, which we're finding to be very, very dangerous. And the one thing is if you have a sunscreen from last year, if it does not have an expiration date on it, you really don't know when it was made, how long was it in the warehouse, how long was it on the shelf in the store when you bought it. It may not be any good. So your best bet is to, at the end of the season, throw your sunscreens away and go get new sunscreens and look for the ones with these better products in.
Not only get new sunscreen, get better sunscreen.
Get better sunscreen. And don't waste your money on the, 50, 75, 80, 100 because you're not doing yourself a favor. You're just hurting your bank account. We all want to save money, so get the good sunscreens with a normal SPF. 30 is fine. 50 does really not protect you. And they're actually a big push to not allow manufacturers to put anything over 50 because it's really a false sense of security.
And that's the thing because many people take their kids, and I've seen them at the pool sides, and they're spraying it on because it's easier to spray on. So that's a no-no. Mm-hmm. And kids' skin is, I guess, just as or more susceptible to burn.
I'd say it's more porous. Yeah. I mean, I think skin is your biggest organ. And, so much stuff absorbs through it. And, I mean, there's a reason where we wear gloves when you mess with chemicals. Well, you're putting chemicals all over your skin. And, just the disruptions of what oxybenzone does. One thing I didn't mention is it, increases estrogen, but it's been associated with endometriosis in women. And if you're a woman that's had endometriosis or know someone, it's a very painful, awful condition. And so why would you want to put something on your skin that's going to increase your risk to that, especially if it's going to give you a skin allergy and you're going to have a rash all over your body at the same time. So, and when you think about the kids, I said it's a big risk to inhale those chemicals. Well, think about where your child is when you're spraying it, and that stuff's all coming up over their head. You can see it.
Yeah.
And they're breathing it in. So, are you going to hold their nose and cover their mouth and close their eyes? I mean, yes, it takes longer to put a good quality lotion and rub it all over them, but you're doing your child a huge favor by doing that.
Alyson, what's going on at Medical Pharmacy?
We have had such a nice, enjoyable week. You can tell that school's out, people are on vacation. It's not been as crazy, but we are, starting to see some more people asking us about the HCG for weight loss. We have had a couple of very successful patients losing weight loss with the HCG. Still doing all the durable medical equipment. So if you've got that, maybe an elderly parent that has trouble getting around, and we've been lucky so far this summer. The weather's been beautiful. We have the scooters and the power chairs to help them get out and be mobile and enjoy some of the sunshine. And other than that, we're just continuing to try to reach out in the community. And I know we'll be part of the Flagey Memorial Health Clinic that's coming up in September. So yeah, we're just out there trying to make a difference.
And as always, if anybody has, say, an ailment or a condition, yes, many of them do need to be seen by a doctor, but take my advice. You can call Medica Pharmacy, a representative of Medica Pharmacy, and say, this is what's going on. And many times there's some over-the-counter, some products, some natural products out there to help. And from my situation, as I told you, I don't know what all helped, but I do know that you recommended some products there. I picked them up before I went on vacation, and when I came back, they were surprised to see that I was walking much better and feeling much better. And so there's a lot of things out there that maybe we can put into our bodies that can help us heal or be stronger.
Yeah, it's it's interesting. I know that we talked about something called Curamax, and a lot of people think of something sore, they immediately think for Advil, Motrin, or Aleve. It's interesting to know that those drugs work on just one little receptor in your body for inflammation, and a lot of people can't take them. They upset their stomach or they're allergic. So there's something called Curamax Pro. It has turmeric in it. It's a great anti-inflammatory. It's perfectly fine if you can't take ibuprofen. It doesn't upset the stomach, but it works on about 50 different receptors for inflammation. We have another product that we use for specific joint pain. If you've got an acute tennis elbow or a sprained ankle, it's called Biozyme, and you just take it for 3 or 4 days until your inflammation goes away. Again, as effective as ibuprofen without the stomach irritations and the allergic reactions. But if you're an athlete in the summer and you're very active, you tend to have higher needs for magnesium, and magnesium is what helps your muscles relax. So you get tight muscles, you get sore muscles, you might tear a muscle, pull a muscle. So you need to make sure you're intaking enough magnesium if you're out there sweating all those electrolytes out. So,
and you might, if you have muscle spasms like I was having.
Yes, magnesium is one of the best muscle relaxers. So you can see these people coming in all the time, and they're on pain medicines, and they're on 3 different things trying to alleviate inflammation and pain, and still are suffering. So sometimes just, giving the body what it needs instead of just targeting that, inflammation on one area does the wonders. I am glad that you did better.
So is everybody that was with me. Well, again, we thank you for coming in today, and the topic today was sunscreens, and the thing is, just be wise about it.
Very much so. And, if you have any questions about it, there's a lot of information on that website. If you can see all this plethora of papers, I was trying to sift through them to get the information, but go to that website, and if there's something you don't understand or a product you can't find, see if we can help you find it. Just give us a call and see if we can get something in for you.
The website is ewg.org, and you said put a /2013 sunscreen and take you right to it.
That's exactly right.
Alyson, thank you very much for this show of For Your Health, presentation of Medica Pharmacy that you hear on WBRT and see on BRTV. And thank you, and we'll see you in a couple of weeks.
All right, sounds good.